Hello everyone, this is Kevin Kruse here with Kruse Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. For total shoulder, some of the things we like to talk about preoperatively are, again, the rehabilitation that you're going to have. Typically for shoulder arthroplasty, we do the first 6 weeks of physical therapy at the house. The second 6 weeks is done at outpatient. We have you come into the hospital, you have the operation, you stay at the hospital for either 1 to 2 nights. That's if you're a Medicare patient, because the government forces us to keep you there in order for them to pay us to do the surgery. If you're a private patient, I'll actually do your patient as an outpatient if you choose to. I'm perfectly open to doing outpatient shoulder arthroplasty because we have minimal blood loss, almost zero pain after the operation. And for me, I don't see the point of keeping someone there overnight unless your insurance company, which if you're Medicare is the U.S. government, is forcing us to do that in order to get reimbursed for the operation. So afterwards, the amount of pain you're going to have after shoulder arthroplasty is surprisingly low. If you take what we're doing with the shoulder replacement, you have a very, very severely arthritic joint. You've had pain for many years, very likely. And then we go in there and instantly we take away that arthritic pain. In order to get the implant in, we have to make an incision. So we remove the arthritis pain right away, but in order to get the arthritis pain to go away, we have to make incisions to get the implants in. And the pain from those implants versus the pain from the arthritis is asymmetric. So that's a long-winded way of saying when I see patients back at 2 weeks after the operation, I ask them a very simple question. What is your pain today compared to the pain that you had before you had this operation? And 70 to 80% of my patients tell me that it is significantly less and that it continues to improve up to a year after that operation. So even though a shoulder replacement is a big operation, the pain relief is typically pretty dramatic and pretty quick, surprisingly quick actually when you look at the numbers. Other things to think about with a shoulder replacement, typically a shoulder replacement is an easier recovery than a rotator cuff because we're not limiting your motion after the operation. I have people wear a sling for 2 weeks after the shoulder replacement, but I let you lift and elevate your arm as much as you want from day one. I don't want you going behind the back or really far out to the side. And then nothing more than 5 pounds for 3 months. After 3 months, you can do what you want with your shoulder. So in general, a shoulder replacement recovery, and I've polled my patients on this, the vast majority of my patients tell me that it's not nearly as arduous as they thought it was going to be. The pain is not as bad as they thought it was going to be, and the restrictions are not nearly as restrictive as they thought they were going to be.